edition of Annie Otto's vlog. If today's your first day watching me, you are welcome. If you're a returning fan, thank you so much for coming back. I really love and appreciate you. Please do not forget to like, share, and comment on my video. In today's edition, we are zooming into health. We are going to be talking about arthritis. So arthritis is joint inflammation, swelling and tenderness in one or more joints, causing lots of pain, stiffness that often gets worse with age. So arthritis doesn't discriminate as long as you are 30 years and above. We have seen it in younger years though, but they are worse in people 30 years and over. Arthritis is the leading cause of disability worldwide. According to the Center for Disease Control and Prevention in 2021, 1 in every 5 adults in the United States of America has arthritis, has been diagnosed with arthritis. 1 in every 5. That's very high. According to my online sources, a study was done across hospitals in Africa in December 2023. Between 9 to 13% of adults over 30 years in Africa has arthritis. There are so many types of arthritis, but we are going to zoom into just the 2 most common types of arthritis. There are osteoarthritis and rheumatoid arthritis. So osteoarthritis is the most common form of arthritis. It occurs when the protective cartilage that cushions the ends of the bone wears down over time. So cartilage, in other words, is the hard, slippery tissue that covers the end of the bone where the joints are formed. Osteoarthritis mainly affects the hands, the knees, the hip, the spine, okay? That's the bigger bones. That's where osteoarthritis affects. Rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joint. It is an autoimmune disorder. That means your immune system mistakenly attacks your own body's tissue. It causes painful swelling of the joints that eventually results in bone erosion and joint deformation. So rheumatoid arthritis affects the little joints, seen in your toes, in your fingers, and your wrist area and your ankles. So these are where the rheumatoid arthritis affects. So again, you can know the difference. Osteoarthritis affects the bigger bones. That means your backbone, your hip. Then rheumatoid arthritis affects the little bones. That means your finger joints and your toe joints, your ankles and your wrist. What are the risk factors of arthritis? I'm going to take a general shot at this. So combining the arthritis as a bigger picture, what are the risk factors of arthritis? There are so many risk factors. We are going to narrow down to the most important one. Number 1, family history. Number 2, old age. If you are 30 years and older, your gender. Arthritis affects more women than men. Number 4, previous joint issues. So if you have had broken joints and other things, it's going to affect you. Number 5, obesity. If you are obese, you're going to have a lot of stress on your joints. And number 6, joint deformation. Number 7, certain metabolic diseases such as diabetes, too much iron. All this can also cause arthritis. Number 8, repeated stress on your joints. Number 9, smoking. Number 10, tobacco use. So all these things will put you at the risk of developing arthritis. In a bigger picture, what are the signs and symptoms of arthritis? When you are being affected by arthritis, your joints will have lots of pain, stiffness. That means it's just like that. You can't move it. Swelling, redness, decreased range of motion. You can't just move your joints as easily as possible. Even shaking your waist or your body, those are going to face lots of difficulties, lots of joint alignment and shape. You see people bending like this, bending like that, bending forward or backwards. That's a sign of arthritis. The joints alignments are just in disarray, so they are no longer the way they intended to be. Bone spurs, that means around your joint you see some lumps, you know, puffing up and down, and it's red, it's painful around your joints area, especially on your fingers and toes. Restricted movement, so you find yourself you can't move the way you want to move. Getting up is problem, sitting down is problem, lying down is problem, turning around is problem. You see you're very stiff and it's so painful, you can't just move without feeling this heavy pain, this heavy stress on your bone, your joints. So this is arthritis. It's very, very common, and a lot of people are being affected by it. So arthritis is being worsened by cold weather. Arthritis gets worse during winter period. Okay. If you are experiencing any of these signs and symptoms mentioned, it's time to go and see your doctor. So your doctor will have a physical examination of your joints. He will look for swelling, redness, and warmth around your joint area. Lab test done to analyze your blood, your urine, and the joint fluid. Another one is imaging, something like X-ray, computerized tomography, that's CT scan, magnetic resonance imaging, MRI, and also ultrasound can be used to diagnose arthritis. What can you do to help yourself at home? What are the home remedies for arthritis? Weight loss. So if you are overweight, you got to lose weight. You got to drop a few pounds to release that pressure on your joints. So your mobility will increase, as well as it will limit the joint injuries that would have happened in the future. Number 2, exercise. So regular exercise helps to keep your joints flexible. Something like swimming, you know, moving your hands and all that will help your joints to maintain flexibility. Exercise will also reduce the bone joint stress. That is another good exercise for people that have arthritis. That means stretching and movement of the joints. It will also help you to release arthritis. Number 3, heat and cold. So putting heat in those areas that have the swelling, the pain, putting cold, whatever works for you better. So heat pads or cold packs can also release the pain and swelling caused by arthritis. Assistive devices, something like cane, walker, beautiful shoes that is meant for people with arthritis. You raise your toilet seat to a comfortable level so you don't have to bend or sit too low. Another one is also making sure that you sit in a comfortable chair in your home. That's chairs that are not too low but has a good cushion to make you comfortable. Supplements. So according to studies, fish oil have been seen to reduce the symptoms of arthritis. So it's good to take at least fish oil once a day. Another one is massage. You know, light stroking and kneading of muscles may increase the blood flow to your joints, you know, especially the joints that are affected by arthritis. So good slow movement, massage will also help on those joints. If you are using tobacco, you got to stop. If you are smoking, you got to stop. During winter, please keep warm. These are the things you can do at home to help yourself when you have arthritis. What are the medical treatment for arthritis? You know, we have talked about what you can do, but what can medicine do for you? Number 1, medications. So if they give you non-steroid anti-inflammatory drugs instead, this can help to relieve the pain as well as reduce the swelling. So medications like naproxen, Advil, Aleve, Motrin. Please make sure you have food in your stomach, no matter how little, before you take any of these medications, the NSAID, because they can irritate the digestive system. Other medications like steroid can also help. Things like prednisone, they can also help to reduce the inflammation and the pain. That's the swelling that's around your joint. It will help to reduce it. So steroid can come in pills, in injections that is injected directly into the joint, as well as some gels and creams and ointments. Yes, steroid can come in those forms. So look out for it when you go to your doctor's office. So another group of medication is the disease-modifying anti-rheumatic drugs. So this medication slows down the progression of the disease. It's not going to cure it. It's not going to take it away, but it slows down the progression of it. Another type of treatment is therapy. So this involves physical therapy and occupational therapy. So this type of exercise will improve your range of motion, also strengthen the muscles surrounding the joints. In other words, the therapist can also give you some splints, some braces you can wear around your wrist or your leg or your back. You know, you just tie it around. So this will support your spine. Another one is surgery. Surgery is a little expensive. In other words, there will be joint repair. So that means the joint surfaces are being smoothed or aligned. They also do joint replacement. That means they remove the damaged joint and replace it with an artificial one. These are mainly done in the hip and knee area. That's when you hear hip replacement, knee replacement. Another type of surgery is joint fusion. These are mainly for smaller joints such as your wrist, your ankle, your fingers. So in this procedure, they remove the ends of the two bones in the joint and then lock those ends together until they heal into one unit. Another type of treatment is acupuncture. So this is a procedure to release or to reduce the joint pains. Arthritis can be very, very disturbing. It has a lot of complications attached to it. So what are the complications caused by arthritis? Number one, osteoporosis. That means a condition that weakens your bone and make them more prone to fracture. That means your bones becomes very, very brittle. They can break at any time. Another complication is rheumatoid nodules. So in your joint areas, there will be some type of nodules, some kind of bumpy areas around your joint, and these bumpy areas on your fingers or toes are very, very painful. Rheumatoid nodules can also form around your heart and lungs, causing a lot of havoc in your system. Another one is carpal tunnel syndrome. That means there is a compression of the nerves that serve your hands and fingers. You can't move them because they become very, very stiff and swollen. You can't move it freely. Another one is lymphoma. That means there is increased risk of blood cancer that develop in the lymph system because of arthritis. Another one is chronic joint pain. This person is always hurting. This person is always having pain. I can't move. I can't sit. I can't walk. I can't bend. I can't, so much pain, chronic pain, everlasting pain. That's arthritis. Another one is depression and sleep disturbance, and this will cause a lot of disability in this person's life. That's arthritis. So please, whatever you can do, keep moving, keep exercising, losing weight, doing all sorts of things that I have mentioned in the remedy section. You need to carry on with them. Okay guys, so these are the main things I need to talk about. So please do not forget to like, share and comment on my videos. I'm your Glow Annie Author. I love you guys. Please stay safe.